All right, good afternoon, and thank you as always for being here. I am joined again today by my colleagues, Dr. Michael Apostolakos and Dr. Robert Mayo from U of R Medicine and Rochester Regional Health, respectively. I again want to thank members of the media as well for joining us here today. I apologize here, my computer is... Sorry. Technical difficulties. I will begin today with a few brief remarks, and then we'll answer your questions as best as we can. As you are aware, we now have confirmation of COVID-19, the Omicron variant, here present in Monroe County and in our region. This is not a surprise. We saw this coming, which gave us some time to prepare. But while there is always more that we can do, I am proud that our plan to distribute home test kits throughout the community came to fruition when it did. I'm grateful that many in our community have begun to get their vaccines and their boosters, as evidenced by an unprecedented amount of demand at the Monroe County vaccine and test sites throughout the last week. And I'm also grateful that our community has a renewed sense of why it's important to be wearing a mask. Make no mistake, we are headed into another surge of COVID, whether we like it or not. And while it's important to rely on what we have learned from previous surges, we also need to be open to still learning more. Omicron is not the same as Delta. In some ways, we are learning the situation is more favorable than before. And at the same time, we are learning features of Omicron that will present new challenges. As before, we will get through this, and we will be better off if we do so by following the science and the data about what works and what does not work. I know many of you are carefully considering how to make your holiday gatherings as safe as possible. So now the big question, how does the Omicron variant change what we know works? And to be perfectly honest, we do not yet have all of the answers to that question. The scientific community here, across the country and across the globe, is working very diligently to understand Omicron more fully, how quickly it spreads, whether it causes the same amount of illness, and how the vaccine and treatments will fare against this new strain. My colleagues and I are here to tell you what we know, what we expect to happen, and what steps you can take to protect yourself and your loved ones in the coming days and weeks. But we have to be open to the fact that we will face some unexpected challenges in the coming days and weeks as we learn more about Omicron. We do know that Omicron is much more contagious than Delta, and that it spreads much more quickly. That means that more people can contract the infection in a shorter amount of time, including during that pre-symptomatic period before someone who develops symptoms does so. In the coming weeks, I believe we will learn more about the clinical picture that results from Omicron infection and ultimately how to manage that in our day-to-day lives. Today, we will report 680 new cases of COVID-19, and I expect that number will significantly be higher in the coming days or even weeks. There will almost certainly be disruptions to our day-to-day lives, and if we do not get on top of this, there could be major disruptions. If, for example, so many of us are sick at once, that it will affect our businesses, our workplaces, and our schools, and as my colleagues will undoubtedly address, our healthcare system, we need to make sure we are doing everything as possible to contain this spread of infection. As you heard on Monday, our goal and my goal is to keep our community, our businesses, and our schools open. We can minimize some of this by doing what we have been doing all along, with a few modifications. Two of the most important steps for the immediate future. Number one is masking when we are with people outside of our own household and doing so as best as we possibly can, even during holiday gatherings. And second, if you are eligible to get your booster shot, you will have significantly greater protection against the Omicron variant and its more serious consequences in a matter of days, not weeks. But before I turn things over to Dr. Apostolakos and Dr. Mayo, let me assure you that my team and I will be continuing to monitor this situation very closely throughout the holiday. And if new developments warrant a change in what we are doing, we will be certain to let you know. And with that, I'm going to turn it over first to Dr. Robert Mayo.
Thank you very much, Dr. Mendoza. It's a pleasure to be here with you and with my colleague, Dr. Apostolakos. Thank you to the media for helping us continue this important public dialogue. And I would also like to extend a very hearty thank you to the amazing healthcare workers and essential workers across this community who have continued to do their utmost, making personal sacrifices to serve this community. And all of us have played a role in our choices to be vaccinated, and so I'm expressed to all of you who are vaccinated my appreciation. The COVID pandemic, as Dr. Mendoza has mentioned, continues to be a daunting and major influence in our lives and in our healthcare delivery. This certainly is nothing that any of us had hoped for or would have ever wanted or had anticipated. But here we are, and so we must continue to press forward with perseverance and with collaboration, supporting one another. The COVID pandemic continues to impact Rochester Regional Health Hospitals. Presently, within our 5 Finger Lakes hospitals, there are 196 patients admitted with COVID-19. 45 of them are in our ICUs, and the percentage of those in the ICUs is about 80% are unvaccinated. This speaks to the importance of the protections that vaccinations provide against serious illness. 32% of those ICU patients are on ventilators and are considered critically ill. We hope the best for them. We hope for their recoveries and are doing all that we can to encourage their recoveries through appropriate medical interventions. The Omicron variant is in our community, as Dr. Mendoza mentioned. The early data on this variant will obviously be evolving rapidly over the coming weeks and months. It does definitely appear that booster vaccinations greatly improve the neutralizing antibody titers within our bodies and are very effective at reducing the serious effects of Omicron. It is also likely that more of those who are vaccinated will develop COVID because of the Omicron variant. But do not conclude that the vaccine has not worked. The vaccine continues to protect you and protect you from serious illness, even if a breakthrough case occurs. The impact of COVID extends further within our health system. 4 of our 5 Finger Lakes hospitals are on a restricted surgical schedule in compliance with the Department of Health requirements and regulation. So that unfortunately means that many people who have anticipated surgery will have that surgery delayed. Emergent and essential surgeries continue, and those are prioritized and maintained. But patients should communicate clearly with their doctors and their surgeons so that they understand where their surgical needs fall on this continuum of assessment and prioritization. For protecting yourself, again, I must reiterate that the booster shot is the most important thing. Please continue to schedule your vaccinations so that this community, your family, and yourself can enjoy the benefits of the healthiest life possible. Thank you.
Thank you, Dr. Mayo and Dr. Mendoza. And of course, thank you to the media to be here to help share this message with the community. The fact that the Omicron variant has officially arrived is not a surprise, but it's unwelcome news as families throughout our community prepare for Christmas. Instead of feeling fear and frustration, our hope is that the community will use this as a wake-up call to celebrate safely and to take the steps we need to help keep everyone safe. UR Medicine's central lab facility on Bailey Road confirmed the presence of Omicron. It's one of a handful of clinical labs designated by New York State to conduct genetic sequencing of COVID-positive test samples and identify potential variants. Sequencing results became available yesterday on 125 COVID samples our lab collected between December 1st and the 15th. The Omicron variant was detected in 17 of the samples, 12 from Monroe County residents, 1 from Ontario County, 1 from Wayne County, and the remainder were from residents from out of state. Those numbers sound small, but we know that the Omicron variant spreads very rapidly. We should assume that the prevalence of the Omicron variant is already high in our community, and that it will soon be the dominant form of COVID here, if it isn't already. There's a lot that our scientists don't know yet about Omicron. However, we have a strong sense of what to expect based on the experience in other countries and communities. One thing to anticipate is rapid increase in the number of new cases reported daily, just like we're seeing in New York City. Many of these cases will be breakthrough infections in people who are already vaccinated. As you've already heard, it's important for the public not to be fooled by this. While breakthrough infections will occur, we know that COVID illness caused by the Omicron variant is less severe in people who are fully vaccinated. That's especially true for those who have received their booster shots. To put it simply, the more vaccinated you are, the less likely it is that Omicron will make you seriously ill. So please get your booster shot now if you are eligible. It's one of the best gifts you can give your family and our hospital workers who will spend their holidays caring for patients. On Monday, I had the pleasure to join in promoting the 3 steps people should take to keep our businesses, schools, and hospitals open. Get vaccinated, get your booster shot, and wear a mask when you're in public spaces. The Omicron variant makes those 3 steps even more critical. And because it spreads so easily, we need to wear masks that provide better protection. A simple cloth mask alone does not protect as well against Omicron. A surgical mask is better, and a surgical mask covered by a cloth mask is even better than that. Many of us were double masked this way at Monday's announcement. And if you have access to an N95 or other respirator type mask, that's ideal. These are the masks we wear in the hospital to care for COVID patients without spreading infection. Today, Strong Memorial Hospital is caring for 126 patients with active COVID, including 45 in the intensive care unit. Those numbers represent a significant increase from 2 weeks ago when Strong had 98 COVID patients and 37 in the ICU. But our overall hospitalization numbers have stabilized, giving us the capacity we need to care for COVID and non-COVID patients. Whether we can maintain the capacity will depend largely on the decisions people make during this holiday season. Please get a booster shot if you're eligible. Wear a mask that provides good protection when you're in public. Enjoy the holidays, but celebrate safely in small gatherings, and be especially careful around friends or family members at risk of severe COVID illness. With that, I'll turn it back to Commissioner Mendoza.
Thank you, Dr. Apostolakos. Before we take any questions, I wanted to spend a few moments sharing some updates on contact tracing. As many of you know, the volume of cases has increased, which has increased the strain on the state and local contact tracing system. And on top of that, a statewide system outage occurred earlier this week, which further slowed down the case investigation process. So please, we want the public to know that if you test positive for COVID-19, please don't wait for the Department of Public Health to call you before taking action. We want you to immediately isolate. Stay in a separate area of your home and use a separate bathroom if that is available to you. If you have to come close to somebody else in your home, we ask that you do so with both of you wearing a mask when you are together. I realize that this is difficult, but until we know more about Omicron, I would still want to prevent the spread of infections wherever possible, including in our households. And let people who might have been exposed to you know that you were in their presence, and let them know that they should quarantine. By now, most of us know what to do, and there are plenty of resources available to you online and on our website. So again, please do not wait until the Department of Public Health calls you. If you test positive or think you have been exposed to somebody who is infected, please do what you can in the meantime to keep the virus from spreading to others. And with that, I want to thank you all again, and I'll turn it over to Meaghan McDe to facilitate your questions. Thanks.
Thank you, Dr. Mendoza. Our first question today will be from Chase Howell with WHAM.
Hello, everyone. Can you hear me okay?
Yep.
Awesome. So I might ask just one clarification before I get into my questions. Are we saying that Omicron was detected December 1st to the 15th? Is that when we were saying that we recognized it was in the community?
No, the specimens where they were recognized were collected on between December 1st and December 15th, but it takes time to analyze those specimens, and so those results came available just yesterday.
Okay, thank you. Sorry, I just wanted to get some clarification. But my first question is, because Omicron is so transmissible, are you concerned about losing more nurses off the floor? Or is that something that we're concerned about, for both U of R and for Mr. Mayo?
Yes, we are. That is a major concern. We want to keep our employees healthy. As I think you're aware, the previous vaccination orders require that all healthcare workers be vaccinated, and our healthcare workers are. But because of the potential for breakthrough with Omicron, we are at risk of having people out on sick in higher numbers than anticipated. So we are concerned about that.
Yeah, I would echo that. We're very concerned about our faculty and staff becoming infected. We're less concerned about them getting severely ill because the vast majority have been vaccinated and boosted. However, if they get infected with Omicron, obviously they can't work for 10 days, and that could exacerbate a shortage of faculty and staff.
Thank you both so much. And my next question, how long has the Omicron variant been here, and at what rate does it spread?
Well, I can let Dr. Apostolakos let us know when the testing began, but it's really speculation as to how long it's been in the community. If you look at the CDC data, it was essentially non-existent a couple of weeks ago. So we believe that less than 2 weeks, perhaps even less than that, but there's no question that it's here now. Our working hypothesis is that it is the dominant strain in the community. Obviously there are still people in the hospital who are predominantly Delta as far as we know, but we anticipate if there are going to be Omicron infections, and we anticipate that there will be, that we'll start to see those soon.
Yeah, we test only a small sample of the positive tests. So it's possible there could have been Omicron here for a little bit before December 1st, but most likely it arrived here somewhere in that time period between December 1st and December 15th. It spreads rapidly, and I agree with Dr. Mendoza. I believe right now it is the dominant COVID variant in the community right now.
Great. I understand we only have 2 questions, but I just wanted to thank everybody, and thanks, Meaghan, for facilitating this. I appreciate it.
Very welcome. Next up is Josh Atkins from Spectrum.
Hi, Dr. Mendoza. I hope everybody's having a good day and happy holidays. Dr. Mendoza, one thing that is puzzling is that there might be a shortage of tests. This Googling, like CVS might be out of tests, Walgreens. Is there concerns in the county right now that there may not be enough tests for people that want to go see their loved ones this weekend or even next weekend?
Well, there is a concern, and I believe that even with that, we were first out of the gate to get as many out there as we could. Is it enough? Perhaps not, but I do think it's a very important step in the right direction. We are in the process of trying to order more, and we're now competing against every other county in the state and in the country virtually to get these test kits. So we're working as fast as we can to get more test kits out there, but I'm hopeful that what we have gotten available, over 750,000, I think now out into the streets as of last week, that will make an important dent. Will it be enough? No. The reality is Omicron is so contagious. What we're working on is guidance on how and when to test, particularly now that Omicron is the most common variant, we believe. We've got to find a way to prioritize those tests. So for now, what we're advising people to do is to test when they're symptomatic, and or when they're about to have a gathering with people, particularly people who are more vulnerable to severe illness. I think those are the 2 instances where if we had to prioritize the testing, given that test supplies are still relatively limited, we would want people to test when they're symptomatic or when they're about to have a gathering, particularly with people who might be at risk for severe illness.
Thank you. My second question is a follow-up to you saying that you think the cases are going to go up the next few days, few weeks. School's going to be back in session after winter break. What's the talk right now with all the districts in our area? Is there a chance they're going to go remote, in person? What's the dialogue been?
Well, in the last hour, I just got off one of our planning calls with the school leadership, and our plan at this point is for schools to remain open. Right now, we don't have concrete evidence to recommend otherwise, so we are planning as though that will be the case, but we are following the situation very closely. And, as you saw today with one of our school districts, it's the transportation department, food services, some of the critical services within a school. If that is unavailable to the school, that will affect the entire operation of the school. So, there are a lot of things that we need to follow, not just the community transmission rate among adults, but also the severity of illness and the prevalence that we're seeing in the surveillance studies among the school-age children. So there's a lot that we're following that we're going to need to follow for the next 10 days. But the working plan for now is to keep schools open as is on January 3rd or whenever schools open in early January.
Thank you, Dr. Mendoza. Thank you, everybody. Happy holidays.
Thank you, Josh. Christian Garzone from WROC.
The case numbers are lower in children, but that all reflects the previous variant, the Delta variant. We don't have, for now, any experience with Omicron in the schools other than the last week or so. But even with that, the school numbers still seem to be reassuring. So given that that's the case, the last thing we want to do is close down the area that's the safest in our community. But again, we have to follow the numbers. And if that conclusion changes in early January, we'll have to reevaluate. The notion that we all take a 2-week hiatus, that's always been considered in theory, but I think in practice, we know that that's not necessarily going to happen successfully, because I don't think people will strictly isolate for 2 weeks. And there's no guarantee that things will come and go in the span of 2 weeks anyway. So I think we have to approach this in a more nuanced way. I don't think lockdown is the answer. I think we are going to need to ride this out with the tools that we know about, which are getting the vaccine if you haven't gotten it, getting the booster if you're eligible, and wearing a high quality, well-fitted mask, especially when you're indoors. I think it's safe to say that it's very difficult to predict what future variants will look like.
Very good. Thank you, Christian. Noelle Evans, you're up next from WXXI.
Thank you. Can you all hear me okay? It'd be embarrassing if I started and you couldn't. I actually just have an off topic, if you don't mind, Dr. Mendoza. Okay, so we have seen quite a bit of gun violence this year, and I know you and I spoke back in the spring about when someone calls for something as a public health crisis, the kind of logistics of that. And I wonder, after speaking with the Monroe County Sheriff a bit about this, if you could. Would you want to call for a public health crisis when it comes to the gun violence? What would that do? Especially given, the sort of data that we're seeing more now, how this affects children, not just in the immediate with that exposure to violence, but long term.
So, out of respect for my colleagues, I'll just say for now that it is a crisis and it is a public health problem. Public health problems need solutions from multiple sectors, and that's why public health is what it is. And the numbers are of crisis proportions, but how we approach it, I think, is a question for another time.
Great. Happy to follow up on that later on. That's it from me. Thank you so much.
Very good. And Jen Lukey with WHEC, you're up.
Hi, everyone. Merry Christmas. believe it or not, I am a glass half full kind of gal. You all might not believe it, but so I'm wondering, Dr. Apostolakos and Dr. Mayo, if this new variant's less severe, are you hopeful that it will help out the crushing demand you're seeing in your hospitals right now if people don't require that emergency care or that ICU care? And to that point, are the monoclonal treatments and those kind of things available in enough supply to sort of help keep them out of the hospital?
I'll start, Rob, if that's okay with you. I think the evidence suggests that the Omicron variant is probably less severe, but it is so much more infectious that it may infect more people, and the sheer numbers of people infected may lead to as many people requiring hospitalization. And that's our real concern, that so many people will be infected, even if it's less severe, enough people will be severely infected that would cause hospitalizations to go up and possibly cause us to shut down essential services in order to care for everybody with COVID. And that's why the message is so important to get vaccinated. If you're vaccinated, get boosted, and to wear masks, and well-fitted masks and surgical masks or N95 or respirator type masks to help prevent the spread, because that is the concern. The current monoclonal antibodies are not effective against the Omicron variant. There is a newer monoclonal antibody by the name of sotrovimab, which is effective, and we received our first shipment today. And but once again, not enough to care for as many people that need the drug. The other treatments, steroids, remdesivir, are still effective in treating the Omicron variant, but the traditional monoclonals we've used are not effective, although there is one now that is.
Yeah, I fully concur with Dr. Apostolakos' statements. Ideally, it'd be wonderful if there are fewer hospitalizations. But upper respiratory infections provoke asthma, they provoke COPD and other chronic respiratory illnesses. And so it's hard to know how that will sort out. So the jury is still out on that question. And similarly, we are placing orders for the sotrovimab, and we'll be closely following other therapies that come out and utilizing them appropriately.
And just for clarity's sake, I guess initially when the news kind of came out that we were so overcrowded, we were going to stop essential surgeries or non-essential surgeries. That is sort of indefinite at this point, right? I mean, initially I know you said it was a 2-week pause, but you're sort of at the mercy now of the state and what they allow you to do and not do. But we're not just talking surgeries that require inpatient hospital stays anymore, right? So if you guys could both clarify what your health systems are doing and aren't doing and how long you think that might last.
So as you said, by state order, because our hospital's been more than 95% full, we've paused non-essential surgeries, both inpatient and out, and that is an indefinite period where each week the state will look at our percentage of hospitalization use of beds and determine whether we can unpause our non-essential surgeries. Now, the list of essential surgeries is quite long, and therefore the majority of our surgeries are continuing, but the ones that are truly non-essential have been paused indefinitely.
Yes, the Department of Health said that in the review of hospital census data, they would bookmark every Wednesday as the day that they would review that data, make a determination, and release those determinations for the affected hospitals, and then those would take effect the following Thursday. So it gives the hospitals time to adjust this necessary schedules, contact patients, and so forth. And they have been consistent with that plan, and we appreciate that consistency. And right now, we anticipate that any changes in that, those determinations would be, they're based on a couple weeks of data. So they want to see that we are lower, our census is lower than that benchmark for a couple weeks before they recommend expanding the surgery schedule again. So one of the RH hospitals was placed on the restricted list and then was taken off the restricted list already. That was Canton Potsdam Hospital. So we see them adjusting as appropriate.
But I mean, locally here, do you foresee it will be weeks and weeks still based on our capacity?
Very possibly, you know. It's always hard to predict these things, but for the time being, yes, that appears to be the case.
All right, very good. That was the last reporter I had. Did I miss anyone? If not, I think we're all set then.
Thank you, everyone.
Thank you all. Happy holidays.
Thank you. Happy holidays.
And
Bye now.
Merry Christmas.